So this brings us to complex PTSD. So after that day that I taught about trauma, and after I talked about single incident trauma, I tell that story and I say, well, this really, when we talk about complex trauma, we're talking about two different things. One is you can have an adult who had all of those things that I talked about in childhood, but then has months to years of overwhelming events, right? Or traumatic stress for years, months to years. The other way to get it is if you have developmental trauma, right? Developmental trauma, if you have trauma, when in the first 3 years of your life, you absolutely have attachment trauma, right? If you had, because if you have trauma in your childhood and you have somebody that can hold you in their mind and their heart, and you have somebody that can regulate you, you have somebody that sees your feelings and sees you having feelings, let me say it that way, sees you having emotions and is able to label the emotions up and down, regulate you. It's not the incident, right? It's how the person experienced it and then how it was handled by the adults, right? So if you don't have that, if you don't have primary caretakers that can mirror you, that can up and down regulate you, um, or not only that, if they are the cause of the dysregulation, whether it's abuse or neglect, if they're the cause of it, then you have a brain that's being bathed in cortisol, a brain that's being, that doesn't have the same opioid receptors being formed because that's not what's happening. Cortisol is out, not opioids. So not oxytocin for the bonding chemical. What's out is the stress hormone, right? So we have cortisol and adrenaline out. And what happens as the brain's developing, right? We're going to come into each developmental stage now with a handicap. So I'm going to turn this and I say, because this is when we start to talk about adverse childhood experiences. There's a study done by Vincent Felitti and Robert Anda that I'm going to go over with you. I interviewed a whole bunch of people for this, the who's who in the world of trauma, but you're going to meet Dr. Vincent Felitti and you're going to meet Robert Anda. We'll talk a little bit about that. And then we'll neurodevelopment and attachment. So I always say in order to talk about complex trauma, we have to go over these things, because even if you're working with adults, it doesn't mean you don't need to understand attachment, because attachment is an implicit memory, right? So our strategies of how things work in what our experiences are in close relationships, that becomes an implicit memory. Bowlby called it internal working model, but it's an implicit memory of how relationships work, right? So they get activated out of awareness. And if we don't recognize them, right, if we don't work them out, we play them out, right? You've heard people say, oh, I married my mother, I married my father, or why am I always with the same guy or the same girl or the same, why do these relationships look so different in the beginning? And now then it turns out the person has the same, they treat me the same way. Well, these are about attachment strategies. These are about our secure or insecure attachments to our primary caretakers. Unless there's enough corrective experiences, that is what is running the show. Okay, so I'm going to talk a little bit about this. I have a quote that I want to read you, and this. Oh, I got to go back. Sorry about that. I have a quote that I want to read you, and this is it's a paper called "The Case for Investing in Disadvantaged Young Children" by James Heckman. James Heckman, this Heckman study is it's famous, it's widely known, but Bruce Perry talks about it, and he says, ultimately, what determines how children survive trauma, physically, emotionally, or psychologically, is whether the people around them, particularly the adults that they should be able to trust, to rely upon, that they stand with them with love, support, and encouragement. He says, fire can warm or consume, water can drench or drown, wind can caress or cut, and so it is with human relationships. We can both create and destroy, nurture and terrorize, traumatize and heal each other. So there's one more. I usually cry at that one, but since I'm not looking at any faces, it's easier not to. But John Briere, who is also a trauma specialist with kids, he says, if we could somehow end child abuse and neglect, the 800 pages of the DSM would be shrunk to a pamphlet in 2 generations. So anyway, those are two things that I like to bring them out first, because before we talk about adverse childhood experiences, why would we be talking about it? Well, it turns out that there's this study that was done in addition to the Heckman study, a collaboration between Kaiser Permanente, which is it's a hospital system, but it's also an insurance system in San Diego, and the Centers for Disease Control. So Robert Onda was from the Centers for Disease Control, and Vincent Felitti is from Kaiser Permanente. Now, if you have those materials, the ACE study should be the first one that you have. So if you have some literature there, you're going to hear from both of them, but you're going to hear from Vincent Felitti first. Now, Vincent Felitti is going to talk to you about why he did this, and I do need to tell you that you're going to miss a little part of it, because the interview, I had asked a bunch of questions, but he's explaining before they undertook this ACE study, before they undertook it, he was doing a weight study, and this weight study had 286 people in it. And the question was, these people were 400 to 600 pounds. And the question was, what is the mechanism that has these folks eat themselves to death? And that was what he was studying. And he's going to talk to you about that. He's going to talk about the study that he done, why he did it, but you would have missed that part. So the setup is you're going to hear from, if you're from California, I didn't see anybody from California, but your Surgeon General, Nadine Burke, is going to introduce the ACE study. Then you're going to hear from Vincent Felitti, who actually ran the study, and what it says.
And Kaiser Permanente discovered an exposure that dramatically increased the risk for 7 out of 10 of the leading causes of death in the United States. In high doses, it affects brain development, the immune system, hormonal systems, and even the way our DNA is read and transcribed. Folks who are exposed in very high doses have triple the lifetime risk of heart disease and lung cancer, and a 20-year difference in life expectancy. And yet doctors today are not trained in routine screening or treatment. Now, the exposure I'm talking about is not a pesticide or a pathogen chemical. It's childhood trauma.
So the ACE study ultimately was put together because of all of our counterintuitive findings operating this major obesity program. And it was really designed to answer two very simple questions. We had found that patients in our obesity program had brutal histories of childhood abuse and growing up in massively dysfunctional households. And that when you were dealing with severely obese people, the likelihood of childhood sexual abuse was totally and unexpectedly high. One of the questions was, are these remarkably prevalent adverse childhood experiences at all common in a general population, or is this just some, uniquely peculiar thing of this group that we had in our weight program? And B, if so, how do they play out long term? And indeed, those are the two core issues of the ACE study. We have over 80 publications out so far, and we have seen, that in general populations, these childhood experiences are remarkably common and overwhelmingly unknown, not recognized, suppressed, etc. And B, the way they play out roughly a half century later is extraordinary, really heavy-handed, and in direct proportion to the number of different categories of adverse childhood experience. And we studied 10 categories. They're not the only 10, but they were the most common 10 that we saw in an adult, middle-class, middle-aged population in our obesity program. They were 3 categories of abuse: heavy-duty physical abuse, I don't mean spanking, heavy-duty emotional abuse, basically recurrent humiliation, and contact sexual abuse, which was amazingly common, but never spoken of. 2 categories of neglect: emotional neglect and physical neglect, and then 5 categories of major household dysfunction. Growing up in a household where one of the members of your household was an alcoholic or a drug user, where mother was beaten, where someone in the household was chronically depressed, suicidal, mentally ill, or in the state hospital, where one of the members of your household was imprisoned during your childhood or adolescence, and without both biological parents. It was certainly unbelievable to me. I mean, the childhood sexual abuse, which was extraordinarily common in the obesity program, it was roughly 50%. In a general population, 17,500 middle-aged, middle-class adults who made up the ACE study cohort, 28% of the women and 16% of the men self-acknowledged a history of childhood sexual abuse. And I mean, and initially I kept thinking, no, I mean, it can't be true. Got to be doing something wrong here. I don't know what the hell it is. But I mean, this can't be true. People would know if this were true. You know, somebody would have told me. Well, wasn't that what medical school was for?
Well, it really does seem like the invention of the seduction theory, though, doesn't it?
Absolutely. It took a very long time to, to convince myself this was real, but that nobody wanted to know about it. And I remember in 1990, I was invited to present our findings at a national obesity meeting in Atlanta. A big audience, 500-700 people. And some guy, under the guise of asking a question, got up and made the pronouncement, you really need to understand, Dr. Felitti, that people who are more familiar with these matters, like obviously they, recognize that these statements by patients are largely fabrications to provide a cover explanation for failed lives. And I remember standing on that stage thinking, wow, I have really changed. Because had that happened to me, say, 30 or 40 years earlier, I'd have been petrified. And now I'm standing there thinking, do I tell this miserable wretch what I think of him, or just let it slide and not start a riot? So I let it slide. There was a dinner for speakers that evening, and seated next to me was a researcher from the CDC, Dr. David Williamson. And David said to me, look, if what you're saying is true, it's got enormous importance for the country and for the practice of medicine, but nobody's going to believe your 286 cases, no matter how well you've studied them. What we need is a large epidemiologically sound study with thousands of people in it, and from a general population, not some, strange program that you have somewhere. Yeah, well, okay, we could do that, David. I mean, I have 58,000 people here going through the department, et cetera. How many? Well, we settled on 26,000. So we asked 26,000, and 17,500 agreed to cooperate with us. And we have been following them forward now since 1995, roughly. And what we have learned from them has been extraordinary. First, in the prevalence of these life experiences in childhood in a clearly middle-class population. Not something that you could dismiss as, I don't see those people, etc. So we discovered A, the prevalence was remarkable in the general population, and B, the impact a half century later was extraordinary in terms of emotional state, mental illness, social malfunction, occupational performance, biomedical health, disease, and premature death. We studied 10 categories, and 11% of the people, 1 in 9, had 5 or more categories that they had experienced. Oh, and that was interesting too, because the categories, the 10 that we studied, were essentially co-equal in impact.